Hello, my name is Juliana Solosky, and in this video I will be discussing culturally sensitive care in nursing. The article that I chose to use for this assignment was entitled Supporting Muslim Families Before and After a Death in Neonatal and Pediatric Intensive Care Units. The article discusses the way in which nurses can care for clients and for their families of Muslim culture who live in Saudi Arabia. Some background information on the Islamic religion and culture in Saudi Arabia is as follows. The people speak Arabic and are immersed in Muslim culture. Because the value of family is held to the highest regard, it is imperative that the nurse involves the family in their infant or child's care, both prior to and after their death. Muslims in Saudi Arabia also strongly value privacy, prefer the restriction of physical touch, and maintain a modest appearance. So the response of the nurse should be to ensure that consent is given by the patient in all situations, and confidentiality is respected in order to adhere to these values. A nurse should also educate themselves on the diet modifications of their patients to assure a culturally correct provision of food. In terms of religious practices, the patients in the article practice the religion of Islam, in which prayer 5 times a day is essential, facing towards Mecca, and death is seen as a reflection of God's will, and is accepted with prayer, meditation, and patience according to the 5 pillars of Islam. The most important lessons that I learned from reading and writing on this article include the inevitability of cultural and religious differences between nurse and patient, and the importance of respecting those differences. Regardless of whether or not a nurse agrees with or fully understands such differences, the nurse must educate themselves, demonstrate tolerance, and possess an open style of communication with clients in order to provide cultural sensitive care. In addition, I learned that the meaning of death is extremely different for different cultures, such as that of the Muslim patients in this article, and that such practices and beliefs must be considered. After writing this paper, I now have a better understanding of the Muslim culture and how to provide culturally sensitive care to this population in the event that it is necessary. Additionally, I have gained an increased awareness of the disparities that exist in healthcare among diverse populations and cultures. Finally, I am more knowledgeable on techniques to improve communication and demonstrate respectful care to diverse cultures in general. Thank you for listening, and I hope you learned something about this as well.